Hi, Rod Rohrich, board certified plastic surgeon, rhinoplasty expert in Dallas, Texas. Let's talk about male rhinoplasty. Male rhinoplasty, their analysis, their procedure is quite different in their endpoint than a female. Often their skin is thicker, their underlying framework may be somewhat more deviated, and sometimes their framework isn't strong enough, so it has to be brought forward. And in this young man, he had a very ultra-projecting deviated nose of both his septum and his bony pyramid, so that had to be straightened, brought back to the midline, and made smaller and derotated. So in these types of patients, you have to really reshape the underlying framework and then tension not only the dorsum, the structures of the dorsum, but also the tip. And in this case, we tensioned the tip, we softened it, we brought it back, and as you'll see, at 2 months post-op, he looks amazing. It's been a game changer, a life changer for him, as he says. At both of his follow-up visits, it's really been something that has really improved his self-esteem. You can see it and you can actually hear it in his voice when you see him even early post-op and then at 2 months. The rationale for this type of procedure is that in male rhinoplasty, it's really much more challenging, especially in this type of patient. So males really have to have a good understanding of what the outcome will be. And I think that's really a long discussion that you have to have with them preoperatively about their 3 top concerns, what you can and cannot do. And obviously after you're done, you never leave the operating room until it looks as good as it can look, but then it's up to how you heal. It's 90% of it is how you heal, it's God and wound healing. It's your genetics. And fortunately in this patient, he looks amazing at 2 months, and he'll look even more so at 12 and 15 months, which is really how long it usually takes in patients like this that have thick skin in males. So hope you enjoy this video, and please give me your feedback and comments and let me know what else you'd like to talk about both rhinoplasty and plastic surgery and beyond, to help you become a better you and a more informed you. Thank you. I'm here with David, and we're doing a rhinoplasty today. How are you doing? How was your weekend?
Good.
Good. Surviving the wonderful heat in Dallas.
Yeah.
It's good. It's good. It's Texas, So tell me the 3 main concerns you have about your nose that we will fix today.
The deviated nasal septum,
which is causing the breathing problems.
and then the bulbous tip, and the bump.
The bump.
Tongue.
Yeah. So he's a good-looking young guy, and he's got wide nasal dorsum. He's got a dorsal hump, narrow mid-vault, deviated nose, and he has excess tip rejection, of course, and that's causing him to have almost a primary polybeak, which is actually causing his tip to actually droop inferiorly. So we'll straighten your nose, take the bump tongue, soften it. It'll be amazing. Really good-looking young guy who desires a rhinoplasty, and his 3 major concerns are he has a dorsal hump, which is very long, and he has a drooping nasal tip because he has a high septum. Its nose is deviated and bulbous, and of course he has a very severely deviated septum. You can see that, which is causing nasal airway problems. I love fixing these types of problems because you're doing both functional and aesthetic improvement. So the goal is to straighten his nose, give him nice dorsal aesthetic lines, soften his dorsum, keeping his masculinity. He would benefit from a chin augmentation, which we did in the image here, but he decided not to do that at this point in time, and he's going to look amazing. This patient exemplifies the severely caudally deviated nose. He has excess tip rejection, but look at his caudally deviated septum. That's causing airway obstruction. And you can see that on his base view here as well as on his front view. So the goal will be to straighten it and also to correct his columellar aesthetic lines. So we're going to do it with an open approach. You can do it multiple different ways. Because we're probably going to be potentially removing some of the columella, we're going to do a stair-step approach here and with lateral infracartilaginous extensions. High septal deviation, dorsal hump, alar flaring and notching, correction, medial lateral osteotomies, correction of septum, tip reshaping, retrograde alar contragrafts, and so much more. High septal deviation, tension tip, bulbous tip, alar notching, and flaring correction. derotation, septal extension grafts, spreader flaps, tension spanning sutures, retrograde alar contours, tip reshaping complete, and more. Very deviated caudal septum, alar notching, excess tip projection, correction, complete tip reshaping, septal reconstruction, retrograde alar contour grafts, alar bases, and more. David is now 10 days post rhinoplasty. What do you think?
I love it. It's amazing.
Yeah, it is amazing. Yeah, I mean, it's phenomenal. What do you like the most?
The shape. Yeah, it doesn't really look anything like my previous photo.
Well, look, he's a good-looking guy, and he just had a very deviated, foreshortened nose and a significant dorsal hump. But yeah, it really makes your nose match your face, right?
Yeah.
Yeah. So you can see, that was really a transformational. Even of course, you've got lots of swelling, and it's just normal post-op here, but it looks quite amazing. And so, how's your breathing?
It's okay. Yeah.
Yeah.
It's a little swollen.
Yeah, it's still swollen. You get straight here, sort of dorsum. We reshaped his whole dorsum. He has a nice beginning, a slight, just refinement of his nasal tip. That'll take a year because you're young, you got thick skin, and you're male. So take it easy. We'll put the stereo strips back on. All right.
Okay.
Any questions?
No questions.
Been great.
Yeah, it's good.
Yeah. So, all right. Would you do it again?
Yes. Sure. Yeah.
Yeah, it looks quite amazing. So, all right, we'll see you in about 6 weeks. So we're 2 months post-op. So, you like your new nose?
Yeah, it's amazing.
Yeah.
I love it.
What's amazing about it?
The shape, the breathing, it's much better.
Yeah, I mean, you can see he's got a pretty amazing shape to his nose. It's softened, and we brought his tip up, and it really does look good. And I think it looks good on all angles. You can see, and it's really straight too. You can see when he turns his head to the left, you can see that really looks unbelievable. And and also the other thing on his front view, you can see that we actually straightened his nose, and we actually brought his tip up and softened it, and got rid of his bulbous tip. And your breathing's a lot better too.
Mm-hmm. Yes.
Good. You can do anything you want now. You're 2 months, but it'll take about 10 to 12 more months to see the final result, especially around the tip. Okay. And he's actually softened enough, so I don't even think you'll need anything done for your tip, like a catalog or anything. Good.
Yeah.
So, enjoying the summer?
Yeah. It's raining. It's raining.
We like the rain in Texas. We never complain about the rain.
That's true.
We never get it. So. All right. Listen. Enjoy it. It looks amazing.